Hello, this is Sudharshan. In this episode, we will talk about the last class of antiarrhythmics, that is class 4, calcium channel blockers, and also the miscellaneous antiarrhythmics. So coming to the class 4, calcium channel blockers. So they will block the L type of the calcium channels. This is important. Type of calcium channel important. L type calcium channels. So we have two kinds of CCBs or calcium channel blockers, dihydropyridines and non-dihydropyridines. Dihydropyridines will have the dipene suffix, nifedipine, amlodipine, felodipine, lesanidipine, etc. And with respect to non-dihydropyridines, verapamil and diltiazem. So let us see non-dihydropyridines in a little more detail. So these are the drugs which are used to treat angina, essential hypertension, and they are known to control the SAN and AVN conduction. And with respect to the side effects, it will cause hypotension, peripheral edema, GI disturbances, gingival hyperplasia, and bradycardia. And educating the patient about the side effects of verapamil and diltiazem is very important. And yes, and then now let us see with the miscellaneous antiarrhythmics. And before that, we have the drug interactions. So calcium channel blockers will interact with the beta blockers, and also it will interact with the nitrates. It will reduce the heart rate, cardiac output, cause the blood pooling, and further. And coming to the finally miscellaneous agents, in that adenosine is a very important thing to know. So the trade name of adenosine is adenocard. And with the mechanism of action, it binds to A1, adenosine 1 receptor, that causes K plus efflux. That is, more amount of the K plus is coming out of the cell. Because of that, the cell reaches resting membrane potential with initial hyperpolarization. And apart from that, it will also act on the calcium channels. And with respect to the side effects, we have a mnemonic that is A to H. A for asystole, B for bronchospasm, C for chest pain, D for dyspnea, E for expensive, F for flushing, H for hypotension and headache. And with the drug interactions, adenosine will interact with methylxanthines like theophylline, etophylline, aminophylline and doxyphylline, and also with the phosphodiesterase 3 inhibitors, which are used to treat platelet disorders like silostazole and dipyridamole. And other miscellaneous agents are there like MgSO4, magnesium sulfate, atropine and isoprenaline. So that is all about the class 4 antiarrhythmics, and that ends the topic antiarrhythmic drugs. So thank you so much. We'll see you in the next lesson.